Welcome to 10-Minute Health Tech, the AI-powered podcast where we dive into healthcare technologies and companies so you don't have to. Today, we're taking a look at Abridge.
Abridge is certainly making some noise in the healthcare AI world.
And they've got the funding to prove it.
Yeah.
A recent Series D funding round brought in a cool $250 million.
Wow.
That's
huge.
That's a hefty vote of confidence from investors.
Yeah.
What do you think is driving this level of interest?
Well, their technology is tackling a major pain point in healthcare.
Okay.
Clinical documentation.
Right.
Clinicians spend hours on paperwork.
Yeah.
And Abridge aims to streamline that process with its AI platform.
So how does it actually work? Does it just record the conversation and spit out a transcript?
It's a bit more sophisticated than that.
Okay.
Abridge listens to patient-clinician conversations in real time and transforms them into structured clinical notes.
Interesting.
Think of it as a highly specialized note-taker that understands medical terminology. Right. Can pull out the key information.
So essentially, it's doing what a really good medical scribe would do.
Exactly.
And Abridge claims this leads to some impressive improvements for clinicians. Their website mentions a 78% decrease in cognitive load. That sounds almost too good to be true.
It's a claim, for sure.
Yeah.
Cognitive load refers to the mental effort involved in completing a task.
Okay.
So in this case, it means clinicians can focus more on their patients and less on mentally processing and documenting every detail of the conversation.
They also report a significant improvement in professional fulfillment.
Yeah.
Abridge says it's up by 53%.
That's impressive.
It seems like clinicians are really feeling the benefits of having this AI assistant by their side.
It makes sense.
Yeah.
Less paperwork, more time with patients, and less after-hours work can definitely contribute to greater job satisfaction.
Right.
Abridge claims that after-hours work is reduced by 86%.
Wow.
That's a significant amount of time given back to clinicians.
That's huge.
Yeah.
It sounds like Abridge is designed to handle the complexities of large healthcare systems. What's the secret sauce that allows them to do that?
They call it the Abridge Contextual Reasoning Engine.
Okay.
Basically, it's the AI brain behind the platform.
Got it.
It's not just transcribing words, it's understanding the context of the conversation.
Interesting.
And using that to create clinically useful and billable notes.
So it's going beyond simple transcription.
Right.
And actually understanding the meaning behind the words being spoken.
Exactly.
And they've managed to integrate this technology with Epic.
Yeah.
Which is huge in the electronic health records world.
Seamless integration with existing systems is essential for widespread adoption.
Absolutely.
And speaking of adoption, Abridge has landed some impressive customers.
Yeah, they've got some big names on their roster, including Johns Hopkins Medicine, Kaiser Permanente, Duke Health, and the Mayo Clinic.
That's impressive.
That says a lot about the credibility of their technology.
For sure. It seems like Abridge is gaining traction with both large healthcare systems and investors.
Yeah.
It's interesting to think about what this kind of technology could mean for the future of healthcare.
It's definitely a sign that AI is becoming more integrated into clinical workflows.
Right.
What possibilities do you see?
Well, if Abridge can deliver on its promises of reducing documentation burdens and improving clinician well-being, it could have a ripple effect throughout the healthcare ecosystem.
That's an interesting point.
Yeah.
We're facing a major shortage of healthcare professionals. Could this type of technology help alleviate that?
Potentially. If we can create a work environment that's less stressful and more focused on patient care, it could make healthcare professions more attractive and help retain existing clinicians.
And what about the impact on patients? How would a technology like Abridge change their experience?
Imagine walking into a doctor's appointment and having your physician fully present and engaged, not distracted by taking notes. That's the kind of patient-centered care that Abridge could facilitate.
It makes sense. When doctors can focus on the conversation, they're more likely to pick up on subtle cues and really understand the patient's concerns.
Exactly.
And by capturing those conversations in detail, Abridge could also help improve the accuracy of medical records.
Right.
This could lead to better continuity of care and reduce the risk of miscommunication.
It's like having a detailed record of everything that was discussed, which can be especially valuable for patients with complex medical histories or multiple conditions.
And let's not forget the potential for AI to go beyond just note-taking.
Yeah.
As Abridge gathers more data, it can start to identify patterns and insights that humans might miss.
Absolutely.
So you're talking about using AI to analyze those conversations.
Right.
And potentially even predict health risks or suggest personalized treatment plans.
Exactly. That's where things start to get really exciting.
Yeah.
We're talking about a future where AI could help personalize healthcare and improve outcomes on a much larger scale.
That's a powerful vision.
It is.
But it's also important to acknowledge that this level of AI integration raises some important questions.
Of course, as with any disruptive technology,
right,
we need to be thoughtful about its implementation and potential impact.
Things like data security and patient privacy are top of mind.
Absolutely.
We need to make sure that these technologies are being used responsibly and ethically.
It's a complex landscape, and we need to be having open conversations about the implications of AI in healthcare.
And we need to make sure that patients are informed and empowered to make decisions about how their data is being used.
It's a collaborative effort.
Yeah.
Patients, clinicians, policymakers, and tech companies all need to work together to ensure that AI is used for good.
It's a lot to consider.
Yeah.
But it's clear that AI is here to stay, and it has the potential to revolutionize healthcare in profound ways.
It's an exciting time to be witnessing this transformation.
Now, we've talked a lot about Abridge in the context of clinical care.
Right.
But I'm curious about its potential applications in other areas of healthcare.
That's a great point.
Yeah.
AI is a versatile tool, and it's already being used in a variety of healthcare settings.
For example,
yeah,
could Abridge's technology be adapted for use in medical research or drug discovery?
Absolutely.
Okay.
Imagine using AI to analyze vast amounts of data from clinical trials or scientific literature.
Right.
It could accelerate the development of new treatments and cures.
It's like having a research assistant that can process information at an incredible speed and uncover hidden connections.
And it's not just about speed. AI can also help improve the accuracy and efficiency of clinical trials.
Yeah.
Making the process of bringing new drugs to market faster and more cost-effective.
That could be a game changer for patients who are waiting for life-saving treatments.
Absolutely.
And in the realm of public health, AI could be used to track disease outbreaks, predict the spread of infections, and identify communities that are most at risk.
So we're talking about using AI to protect populations and improve health outcomes on a global scale.
Exactly.
Yeah.
The potential is enormous.
It is.
But it's important to remember that AI's is not a magic bullet.
You're right.
Yeah.
Technology alone can't solve all the challenges facing healthcare.
We need to be realistic about what AI can and cannot do. It's a tool that can enhance our capabilities, but not replace the human element of healthcare.
Right.
We still need skilled clinicians and passionate caregivers, and a healthcare system that prioritizes the well-being of all individuals.
It's about finding the right balance between technology and humanity.
And ensuring that AI is used ethically and responsibly.
Well said.
It's fascinating how Abridge is focusing on the conversation aspect of healthcare.
Yeah.
They're not just extracting data. They're trying to understand the nuances of human interaction in a clinical setting.
It's a smart approach.
Yeah.
Communication is the foundation of healthcare.
Right.
Think about the interactions between doctors and patients, nurses and caregivers, specialists coordinating care.
Right.
It all hinges on effective communication.
And Abridge seems to recognize that technology shouldn't replace those human connections.
Right.
Instead, AI could be used to enhance communication and make it more efficient and meaningful.
That's the key.
Yeah.
We don't want AI to become a barrier between people.
Right.
It should facilitate better understanding and make those interactions more productive for everyone involved.
It's not just about capturing the words being spoken, but also understanding the emotions and intentions behind them.
Right.
That's a complex challenge for AI.
It is.
Yeah.
But imagine an AI system that could detect subtle cues in a patient's voice or body language,
Okay.
alerting the doctor to potential concerns that might otherwise go unnoticed.
That would be incredible.
Yeah.
Or an AI that could help bridge communication gaps between patients and doctors who speak different languages,
Right.
ensuring that everyone feels heard and understood.
That's a really important point,
Yeah.
especially as healthcare becomes more globalized.
It seems like Abridge is well positioned to push the boundaries of what's possible with AI in healthcare.
I think so.
They've got a strong foundation and a clear vision.
They've certainly made a splash in the industry.
Yeah.
Their technology is addressing a real need, and they're backed by some of the biggest names in healthcare.
So for our listeners who are intrigued by Abridge and want to follow their journey, what would you suggest?
Keep an eye on the healthcare AI landscape.
Okay.
This field is evolving rapidly, and Abridge is likely to be at the forefront of many exciting developments.
It's a fascinating space to watch.
It is.
And who knows what the future holds for AI in healthcare?
The possibilities are truly limitless.
Well said.
Thanks for having me.
Thanks for spending 10 minutes with us, and be sure to look for more 10-Minute Health Tech podcasts.